Good evening, everyone, and welcome to One Healthy Boston's Facebook Live. I'm Kristen Perfettio. When our muscles, bones, and joints are injured, the pain and loss of function can often be very debilitating. Orthopedic care addresses any and all of those injuries of the musculoskeletal system, and it can be used to help patients manage pain and improve chronic conditions like arthritis. Tonight, I'm joined by Dr. Michael Geary, an orthopedic surgeon at South Shore Health. He's here to talk with us today about orthopedic care. What is it exactly? Who can benefit from it? And he's going to talk about all the variety of ways or treatment options that are available with orthopedic care. Dr. Geary, thank you so much for joining us this evening.
Thanks for having me, Kristen.
I just want to get started right away with what is orthopedic care? Can you explain to our audience?
Sure. Broadly speaking, it's a field of medicine and surgery that deals with the treatment, both non-surgical and surgical, the treatment of chronic conditions or acute injuries that affect the musculoskeletal system, and that's the bones, joints, muscles, tendons, ligaments in our body.
Okay, so what are exactly some of the problems or conditions that orthopedic surgeons treat?
Sure, it's a wide variety. As you can imagine, the musculoskeletal system from your upper extremities to your spine to your lower extremities, it's a lot of territory, but broadly speaking, there's overuse injuries, there's degenerative conditions like arthritis, and then there's acute injuries, fractured bones, dislocations, um, sprains, which are injury to ligaments. So it's a wide variety.
Okay, what are some of the most common conditions that you treat?
Sure. Acute injuries, ligament tears in the knee, arthritic conditions um, of the knee, uh, injuries to the shoulder. Those are some of the injuries that I most commonly treat.
And is there a particular age range of patients that you see more typically than others, or does this vary or from, youth all the way to,
Youth all the
elderly?
way up. So, in our practice, we treat young patients who have sports injuries, and we treat much older patients who, have arthritic conditions of their hips or knees or shoulders or fractures. So it's a wide range of ages and a wide range of conditions.
Okay, we're getting some questions already tonight, so
Right.
I'd like to get right to it. We have a question from Sushi. She has suffered from chronic pain for 30 years, and
Okay.
she's allergic to most medicines. She wants to know if there's any alternatives that orthopedic care could offer her.
Sure. Well, treating chronic pain can be a challenging problem. We'd have to begin by seeing where her pain is located. And then, typically with an orthopedic evaluation, we often start with x-rays of that particular body part to see if there's any degenerative process going on. And then an exam. And then, based upon the results of the imaging studies, the physical exam, and a review of her history, there are potentially some options. A lot of times patients that have chronic pain can be benefit from a referral to our pain clinic right here at our office in Two Pond Park, and it's on the second floor. And there are a number of anesthesiologists in that clinic that are excellent at treating chronic pain conditions where there's not, a surgical option for treatment.
Okay. Linda wants to know, she's had osteoarthritis in
hmm
her hands. She drinks a bicarbonate to bring her acid levels down, but
hmm
she's wondering what else she could possibly do.
Sure. Well, again, it depends upon how diffuse the arthritis is in her hands. If it's if it's localized to a few joints, sometimes selective steroid injections can be a benefit. Depending upon the nature of arthritis and the deformity, sometimes if uh, conservative care isn't helpful, there are a variety of surgical options. We do have a number of board certified hand surgeons here in our practice. So for conditions like that, oftentimes we would refer them to one of our hand surgeons for a more complete evaluation. But certainly there are other options besides, supplements for the treatment of hand arthritis.
For people who have musculoskeletal issues or come to you originally with an injury or
Mhm.
pain or arthritis, is the standard way of treating normally to start with things like steroids first before you go to surgery? So I guess what I'm asking is surgery your ultimate last option before you go
Yeah,
to
that's a great question. It really depends on the condition. As I mentioned before, there are kind of chronic overuse conditions, and for a lot of those, you're right. You start with conservative treatment. That isn't always a steroid injection. Sometimes it can be a period of rest, working with a physical therapist. If that's not successful, then sometimes you can try medical therapy or steroid injections. And then if you kind of fail conservative treatment and you meet other certain criteria, then certainly surgery oftentimes can be incredibly helpful. The best example there is the treatment of arthritis in the knee or the hip or the shoulder. Typically, depending upon the severity, you'll start with conservative treatment, and then if you fail, you meet certain criteria, you can do a joint replacement. Having said that, there are some conditions where the only option is surgery. Certain types of fractures, certain types of ligament or tendon tears, and for those things, it can be time sensitive. You want to do the surgery sooner rather than later. So it really does depend on the diagnosis. But you're right, for chronic conditions, we typically start simple and work from there.
Okay. All right. Janet has written in and she says she finds it hard to walk on her heels after having a back surgery. Any
Mhm.
suggestions for her?
Sure. Well, heel pain is incredibly common. Again, a full evaluation would probably enable us to determine a diagnosis. But just hearing that story, the most common cause of heel pain oftentimes is plantar fasciitis, and there are some conservative treatment options for that. Rest, ice. If the patient's able to tolerate anti-inflammatories, that's a consideration. Um, Now, if it occurred after the setting of a spine surgery, then I'm sure Janet has considered this already, but obviously you want to check in with the surgeon and just mention that to the surgeon and see if he or she has any suggestions and if it may be related to the spinal surgery. But just hearing heel pain that occurs without any trauma, most likely it's plantar fasciitis, very common.
I've had that and it is very painful. I feel for you. John has written in. She says that or people hear a lot in general, I need new knees.
Yeah.
What really qualifies someone for a joint replacement and what is the course of care for that?
Yeah, that's a great question, and it's different for each individual. Um, I think that if, first of all, in the evaluation, the patient has severe arthritis on X-ray, so that's kind of the one box you need to check. And then, if that's present, if the pain and disability that they have from their arthritis prevents them from doing things they need to do or like to do, if it limits the quality of their life, then they're a candidate. Now, you can start with conservative treatment there, and for some people it helps, but with real severe arthritis on X-ray, and if the patient's in a lot of pain and is debilitated, you can do some conservative treatment, and that could potentially help temporarily, but ultimately, probably the best thing for them is to consider a joint replacement. And
All right. Debbie says her husband has a bad hernia that surgery has not helped. Are there other treatments?
for hernias, typically hernias that would be a diagnosis that's managed by general surgeons. So it depends upon the nature of the hernia, the location of the hernia. That's not uh, in my area of expertise, but certainly would encourage her to seek consultation with the general surgeon for further evaluation on that hernia. Yeah.
You've had a wonderful career and you've done a ton of orthopedic surgeries. How successful are most of these orthopedic procedures for people?
Success rate's high, and it's gotten better over time. And you never want to recommend a surgery unless you think there's a very high probability of success. Obviously, there's no guarantees, but success rate for most procedures, much higher than 95%.
Okay. All right. Christine asked, what is the best treatment for, and I'm going to butcher this, I'm sure, peroneal tendinitis? Am I saying that
Sure,
correctly?
yep. Peroneal tendinitis. Those are tendons on the outside of your ankle. They allow you to evert your foot. Again, it would depend upon the severity of the tendinitis. If there's a pre-existing injury, typically that's a condition that can be treated conservatively without surgery. So you'd start with physical therapy, maybe a period of immobilization and anti-inflammatory medicines and rest. And oftentimes that's enough. If it's not, then my practice would be to get patients don't respond to conservative treatment to get more information with an MRI to confirm the diagnosis to make sure there's no other process at play. And occasionally, peroneal tendinitis that's associated with instability of the peroneal tendons or tearing of the peroneal tendons. Sometimes that can be treated surgically, again, if patients don't respond to conservative treatment.
Okay. Kim has had her hip done about
Mhm.
15 years ago, but now has a lot of pain. Any advice for her?
Pain in the hip that was replaced.
She did not write that, but I
Okay,
guess we could address perhaps both.
sure. Either scenario, if that would warrant evaluation by an orthopedic surgeon, initially with X-rays and exam. If the longevity of hip replacements typically is longer than 15 years, but one consideration with hip replacements is that the is wear. So over time, most hip replacements are metal and plastic. There's a plastic spacer called polyethylene, and that can wear over time. And if that happens, that can potentially lead to pain down the road. So really, that's something that would warrant orthopedic evaluation. And then the other scenario, if it's her other hip that she didn't have surgery on, it's very possible she has the same process arthritis there too. So um,
Do you do you often get patients who have either a knee replacement or a hip replacement, and then within a couple of years, the other knee replaced and the other hip
absolutely,
replaced?
yep.
Okay, all right.
We'll do them at this. They can be done in certain select patients if they're younger and healthy enough. You could do them at the same time, or you can stage them, months apart. But absolutely, yep.
Okay. Talk about the recovery process for some of these procedures. I mean, I would imagine that medical technology has come a long way in these procedures. You get people walking and moving within a day or so after having surgery. Can you describe what that recovery process is like a little bit?
Yeah, absolutely. And you're right. I mean, there has been a trend towards shorter stays in the hospital for many of the procedures. Um, broadly speaking, we do outpatient surgery, and a lot of that is more of the minimally invasive surgery. A broad category of surgery that we do is called arthroscopy. That's where we make small incisions around the joint and insert instruments through those small incisions to perform the surgery. And almost always that surgery is done in an outpatient setting. That means patients get the surgery and they go home the same day. Oftentimes it's under general anesthesia, sometimes with a nerve block. And then depending upon what the surgery is, that'll dictate what the timeline is for the ultimate recovery. Examples would be rotator cuff repairs. That same day surgery could take an hour to an hour and a half. Patients go home about an hour after surgery. They're in the sling for about a month, and then they're in therapy several months. But usually by 2 to 3 months, they're feeling a lot better. The shoulder is starting to work a lot better. Um, so that would be one example, rotator cuff surgery. Another, outpatient surgery would be knee arthroscopy. That can be even a quicker recovery. 3 to 4 weeks for simple debridements, knee debridements, meniscal debridements. And then the other big category is, if we've had a few questions, is joint replacement. And, in the past, a decade ago, patients would spend several days in the hospital after a joint replacement. Now, there's been a trend where that hospital stay has decreased significantly and patients don't go to rehab, they go home. And physical therapy and nursing goes to their home. And studies have shown patients do better. They're more comfortable at home. They're more comfortable doing their PT at home. And there's even a trend now towards doing some patients doing their total joints uh, same day. So they'll have their joints and go home the same day.
Wow. And are we trending in that direction? Is South Shore Health looking ahead for doing same day type
We
of
are we
procedures?
are trending. Our hospital stays have decreased, and some providers are have begun to do that.
Excellent. That's a perfect segue. You were talking about rotator cuff surgery and so on. Arlene wants to know exactly what the recovery time is after a shoulder surgery. And obviously, I know that would
Yeah,
depend on the severity of her injury, right?
sure. Right. It's not an overnight recovery with shoulder surgery. If it's a rotator cuff tear, again, it depends upon the size of the tear, but generally speaking, most of your recovery is within 3 months. Now you're improving along that period of time, but by 3 months, you should have most of your motion back and a lot of your strength. And you should be feeling better than you did before the surgery. Having said that, there are some patients that certainly meet all those criteria. They're doing better 3 months out. The shoulder's stronger, but they can get continued improvement even 6, 9 months, even up to a year after a procedure like that, like rotator cuff repair.
Okay. You've talked a lot about rheumatoid arthritis today. We got a question from Sandy. She wants to know what the symptoms are of RA.
Yeah, so RA is a little different than osteoarthritis. Osteoarthritis is a degenerative condition. Just over time, the cartilage within the joint can break down. That can lead to deformity of the joint, pain, swelling, loss of motion. With RA, the process is different. It's a autoimmune condition that affects the synovium, which is the lining of the joint. So with RA, the end result can be the same. It can lead to joint destruction and deformity in the joint, swelling, and pain. And sometimes, when that's severe enough, those patients can be a candidate for um, arthroplasty, joint replacement. There are now a number of excellent therapies for rheumatoid arthritis. Again, it's an autoimmune condition where the body's immune system does attack the synovium, the lining of the joint. And that is actually a diagnosis in a condition that's managed by rheumatologists. That's a field of medicine that deals with medical management of joint conditions, in particular conditions like RA. And there are a number of new therapies that exist for RA that are excellent and can prevent the progression of joint destruction. There's actually a lot of commercials on TV for those, and those are biologic treatments, but there are other treatments. But really, RA, the medical management should be by a rheumatologist.
Okay. Okay, terrific. We're joined tonight by Dr. Michael Geary, an orthopedic surgeon at South Shore Health, and we're talking all things about orthopedic care today. Jean has written in, and she says she's had a cortisone shot, and it did not help her hip pain. Does she need to wait a certain amount of time before she decides to have surgery?
Yes. If the injection was for arthritis, the typical practice is to wait 3 months from the last steroid injection. The reason for that is, there's some concern if you do surgery within that window, less than 3 months, that there's potentially an increased risk for an infection. So anytime you do a elective joint replacement, you want to optimize everything to make sure you get the best possible result. So that's the typical timeline, 3 months. That's my practice, at least.
Okay. Amy has written in. She wants to know the difference between impingement tendinitis and a tear relating to the shoulder in a 45-year-old woman.
Sure. Well, impingement is shoulder impingement's a diagnosis where repetitive overhead activity results in impingement, pinching of the rotator cuff against the acromion bone. If you put your hand on the top of the shoulder, that acromion bone is right here. So as you elevate your arm, the rotator cuff and the shoulder bursa can pinch or impinge, and that can lead to inflammation and pain. Over the long term, it can even lead to degenerative tearing of the rotator cuff. So that's one of the mechanisms that's thought to produce degenerative rotator cuff tear. So so basically, the end result of prolonged untreated impingement could potentially be a tear, but that starts off with just inflammation of the soft tissue, including the rotator cuff and the bursa. So a lot of times you'll hear terms like shoulder bursitis, shoulder tendinitis, and in some respects that's the same thing. That's synonymous with shoulder impingement.
Okay, all right. Always learn.
And I hope that answers the question. I don't know.
You're doing great. Debbie wonders, and you may have heard of this or not, if you have any thoughts about something called cool leaf.
Yeah.
Okay. Okay.
Well, that's actually a treatment that we
is?
offer at South Shore Health. That's a procedure that's done by some of the anesthesiologists in our health system, and it's felt to be a minimally invasive type of procedure to treat arthritic pain. It's been approved in the knee, and it's done most commonly in the knee, but it exists for other joints. What it is the nerves that innervate the joint and are responsible for pain perception are heated, and they are essentially temporarily damaged so that the pain perception, this is the theory, that the pain perception is decreased. It doesn't change the fact that, you have arthritis in your knee. It just decreases the perception or severity of that pain that you can experience. Again, not a procedure I do. I have referred some patients for that. Typically, it's in the setting of more moderate arthritis in patients who aren't surgical candidates for whatever reason or just don't want surgery.
Hmm.
It's something else you can try, kind of similar to a cortisone shot. It doesn't last forever, but um, it is a technique and a treatment option that we do have here at South Shore Health. And that would be, again, it would begin with a consultation with an orthopedist in the health system, and if they were a candidate, they could be referred for that to one of the anesthesiologists.
Okay. Speaking of pains in the knee, Christine wants to know is the only what's the I'm sorry, if surgery is the only treatment for a torn meniscus.
No, it's not the only treatment. There's a number of different types of meniscal tears. When you think about tears of the meniscus, you factor in a lot of other things, the age of the patient, whether there's pre-existing arthritis, because in those arthritic knees, they're all going to have meniscal tears. But if the arthritis is severe, it's not the meniscal tear causing the problem; um, it's the arthritis. Now, younger patients that have an acute episode and an injury to the knee, and they can get an acute meniscal tear. And in those situations, oftentimes the best treatment is surgery, especially if it's a large meniscal tear that causes mechanical symptoms. Mechanical symptoms would be catching in the knee or locking of the knee. So again, it would start with an evaluation, x-rays, exam history, and then potentially an MRI. And the MRI really is the best test for determining the exact type of meniscal tear.
Okay. Are there any pre-existing conditions that people may have that may hinder their healing and recovery from these types of surgeries and treatments?
Yeah, broadly speaking, there are a number of factors that can put patients at increased risk for complications. Obesity is one, um, diabetes, smoking, anything that can compromise blood flow. Those for complications specific to the orthopedic procedure, those would be the main ones.
Okay. Michelle has written in and is asking whether imaging ever misses problems. She says she's had her back pain has worsened for years after a car crash, but her doctors say that there is nothing wrong. Any ideas or any suggestions for her?
Yeah, back pain can be a challenging problem diagnosis to treat. The short answer is yeah. Sometimes the imaging doesn't is if it's not a good quality image, in particular an MRI, it may miss something. A well done MRI of the spine usually is usually quite accurate. Maybe not 100%, but for severe conditions, a well done MRI of the spine would be uh, 100% most of the time.
Okay.
Accurate in
Okay.
diagnosis.
You've had a long-standing career, and you're one of our top surgeons here at South Shore Health. How does orthopedic care work at South Shore Health? And just a general synopsis of how or what a patient can expect when they come to you here at South Shore Health.
Sure. Well, I'm in practice at South Shore Orthopedics, which is, we are at South Shore Hospital. That's the hospital that we do all of our work at. And, our office here in Two Pond Park in Hingham, is a musculoskeletal center. We have our offices here on the first floor. We have imaging right here in our office. On the second floor, we have our surgery center, the pain center. The third floor, we have, a physical therapy service, the rehab service here at South Shore Health. So, patients that come here, it'll start with an orthopedic evaluation, and that's, a full history and nature of their joint problem, the nature of, whatever condition they're being evaluated for. We'll get imaging, and we'll do a physical exam. And based upon that initial evaluation, we'll determine if they need any further imaging, such as an MRI, or if oftentimes we can make a diagnosis there and begin some type of treatment, or oftentimes we'll determine if it's an acute injury that surgery would be needed. So it always starts with the evaluation here, and it's always the history, reviewing that, the physical exam, the imaging, and then kind of going from there.
Excellent. Rick has written in. He wants to know if you have any procedures at your disposal that are not surgical. And I know you've talked about this already, but sometimes we get viewers that tune in and out throughout the program.
Sure.
Could you just touch upon some of the non-surgical options you may have?
Yeah, no, absolutely. Depending upon the nature of the condition, sometimes patients just need reassurance and the body can heal itself. So for some acute injuries, it's just time and rest, potentially a brace if it's a sprain of a joint like the knee or the ankle. Um, Sometimes that needs to be supplemented with physical therapists, working with a physical therapist. Sometimes with these acute injuries, it can be difficult to regain motion and strength, and working with a therapist can help there. And then, medical treatment, if the patient is in a lot of pain, sometimes, using anti-inflammatories or other medicines can help manage the pain and inflammation. So again, for a lot of conditions, if we can get things better without surgery and the results are the same, that's what we do. Again, there are some acute injuries like certain types of fractures and tendons and ligament tears where surgery is really the best option. That's what you want to do. But yeah, absolutely. And for degenerative conditions, same thing. We don't just always jump right into joint replacement if patients want to try, working with a therapist. Sometimes if they want to, uh, don't want to have surgery for whatever reason, or, we can try cortisone injections, steroid injections for pain relief too. So that's another office procedure that we'll do here from time to time to help with pain relief.
Okay. Annie had her ankle replaced in February, but she still has a lot of pain and swelling. How long will that last?
Um, in February, it was done.
Yes, yeah.
Yeah, it's hard for me to say. I don't do ankle replacements. I mean, it's something I saw in my training. I think that, obviously, I'm sure Annie's done this. You want to, convey that to your surgeon that did the procedure. But swelling can persist after joint replacement. Sometimes it can take more than 6 months. It depends upon the severity of swelling. It should be trending down. Um, but again, so the fact that she had her surgery in February and still has some swelling in the operative extremity isn't, you know, necessarily out of the norm, but it's something that she should certainly convey to her surgeon that did her ankle replacement, and just just to make her, them aware.
Gotcha. Jean says that her leg felt heavy after a cortisone shot. And why does that happen? So, do you get some folks who have maybe different symptoms after they have cortisone shots?
Yeah, I mean, I guess the cortisone shots. I guess it would depend where. If it's a spinal injection, which they would do in the pain clinic here. Sometimes patients can report that feeling of heaviness, and it can be nerve mediated. It's something that should resolve over time. The exact neural mechanism for why it feels heavy, I'm not exactly sure.
Okay. For people who have had some of these surgeries and treatments, are they able to get back to a somewhat normal lifestyle after? Can they still play sports? Can they still run? Can they still hike and do all the things that they used to do?
Yeah, our goal is to get patients back to their highest level of function, and so, it's a broad question. Some procedures, that's exactly why you do it. The young athlete that tears their ACL or has a fracture, you fix it, and that's your goal, to get them back to the way they were before. Now, patients who have a hip replaced or a knee replaced, you want to treat their pain and get them back to the point where they can do all their activities of daily living without pain, and do a lot of other active things. Now, we don't encourage patients that have knee replacements or hip replacements to go ski double black diamonds and that sort of thing. But the goal is to get patients back to their highest level of function. And for some patients, that's, yeah, doing everything they were doing before, but that's more typically the younger patients with the acute injuries.
And is it pretty common too for a lot of these surgeries that they're going to receive some type of physical therapy treatment afterwards? And how long would that last? And also, how quickly does that take place after a surgery?
Yeah, it is for many procedures. The standard of care is to prescribe physical therapy after, and that's been shown to improve, decrease the recovery time and to optimize the long-term results. And for many procedures like ACL reconstruction, we get them into PT within a couple days of surgery. For in joint replacement, it's that same day we get them up and working with a physical therapist.
Wow, incredible. Brian has written in, he says his left knee snaps, but he has no pain when he's going up the stairs. So he just wants to know, is this a noise problem or is there something more to it? What can he do about that?
Yeah, I mean, I would tell Brian, if he has no pain, at all. He can do everything he wants to do, and his knee makes some noise when he's going up and down stairs. I'd say don't worry about it. Broadly speaking, there are things inside the joint and outside the joint that can cause clicking or make noise. Going up and down stairs, you tend to load the front of your knee, the patellofemoral compartment. It could be, you know, a ligament going around the knee, the IT band, something of that nature. But if it's not painful, don't worry about it. Just live your life. It's not a problem.
When should someone see an orthopedic surgeon or someone like yourself? They're clicking and clacking and all of that. Is it when they start to feel pain that they
Yes.
want to go? So don't let it go for too long, is what you're saying.
Exactly. Yeah. I mean, if Brian's having pain, he should absolutely come in and have that evaluated. But if the joint is making noise and it's associated with other symptoms like loss of motion, joint swelling, pain, instability, locking, um, that would be an indication to get it evaluated. But if it's just an occasional click or noise the knee makes when you're going up and down stairs and there's no pain and there's none of those other symptoms, I would just provide some reassurance that it's not a
Okay, awesome. Denise wants to know, and this is a great question because even I ask myself this sometimes: is icing or heating better for pain?
yeah, it depends upon what you're treating. For acute injuries where there's inflammation and swelling, generally ice is better. That's my recommendation. Heat is oftentimes used if there's a muscle strain that's been present for a period of time. So, there's a lot of uh, you know, information out there. Some people recommend ice within the first 48 and then heat. I mean, my recommendation is typically if it's an acute injury and it's associated with swelling, you want to ice the area of injury. Sometimes some muscle strains and that sort of thing can potentially benefit from heat. But
Okay. Billy wants to know, he wonders if you see recovery time for knee replacement going down in the future.
yes, it already has. That's been the trend, and as I mentioned, duration of stay, hospital length of stay has steadily decreased to the point now where um, some patients are candidates for outpatient joint replacement. So I think as the techniques have evolved and gotten better and the therapy that's been done has improved, then recovery times have uh, decreased, absolutely.
Okay. And Linda would like to know how successful shoulder replacement is, and what about other joints?
Yeah, arthroplasty for the most common joint replaced is the knee, followed by the hip, and then the shoulder. And the results for those three joints is excellent. Greater than 99%. So, and with shoulder the replacements, the very high success rate. Patients do very well with that.
Okay. Dr. Geary, we're going to have to wrap up just shortly, but before we wrap it up, I just wanted to give you an opportunity. Is there anything that you would like our audience to know that is important about orthopedic care, taking care of their bones, their joints? Anything that you just think is important that they should know in seeking care for those things?
Yeah, I mean, I would just encourage everyone if they're living in pain for whatever reason, don't ignore it. Don't try and just push through it. There's a lot of things out there that we can do to help you. So it always starts with an evaluation. And so if people are living in pain or have any type of disability because of a musculoskeletal condition, don't ignore it. Get it checked out. And obviously here at South Shore we'll do everything we can to get you better.
Awesome. Thank you so much for joining us today. We learned some great things. I certainly learned something new for sure. I appreciate your time. And I want to say thank you to all of our Facebook audience who took the time to send in their questions this evening. We appreciate it. I do want to say a great big thank you to WCVB for allowing us this opportunity to bring this content to you this evening. If you missed tonight's segment of One Healthy Boston's Facebook Live, you can tune in to WCVB's Facebook page. You can also find it tomorrow on onehealthyboston.com, their website. You can watch it there. So thanks again, Dr. Geary. Everyone have a great weekend. Take care.
Great. Thanks very much.
Thank you.